Hi, good morning. How are you this morning? How was your week? What are you drinking this morning? I'm on my first cup, so I am drinking my typical um, London Fog with peak tea, PIQE tea, Miss Gray, uh, steamed milk, vanilla, and or organic vanilla and organic stevia. So, yes. Um, all right. So we're going to talk about healing through art therapy. Um, so we're going to get into the benefits today. Next week, we're going to get into the different things that you can do. Art therapy can be a valuable tool offering nonverbal means to process emotions, cope with challenges of treatment, and enhance overall well-being. So how does it help? It can help with emotional expression and processing. So it provides a safe space to express complex emotions like for fear, grief, and anxiety relating to your diagnosis and treatment, and to process these feelings in a non-judgmental environment. So I guess I say that you always want something non-judgmental, and don't judge yourself for the thoughts and feelings that you do have, because you're going to go through a lot of different ones. And some of them you may feel people might judge you for it, understandably. I mean, not that they shouldn't judge you for it, but you feel that they're judging you for it. And so you don't want to you want to be able to express these feelings and get them out. So I always say it's good to get them out. It also reduces distress and anxiety. So it has been shown to lower stress levels, reduce anxiety and depression, and improve mood, potentially by affecting brain chemicals and in inducing a calming effect. So as I always say, when you're not stressing, your immune system's able to do what it needs to do. It's able to work on the main problem or the main situation, which in this case is your cancer. So when you stress, your immune system does not, it's dealing with what you're stressing over and what the things that stress is causing. And so if by not stressing, your immune system's able to focus on the main issue. Also, too, when you stress, keep in mind, stress can cause you to have side effects that from your cancer or from your treatment that you normally probably wouldn't have if you had stress. So stress is a lot of, adds is to me, stress is kind of like adding fuel to the fire. That's just how I feel about it and look at it. Also, it enhances coping skills and resilience. So it can help you develop coping mechanisms, build resilience, and improve your overall quality of life during and after treatment. It also promotes a sense of control. So art can empower you by giving you a sense of agency and control at a time you may feel a loss of control or helpless due to your cancer. When you have cancer, I'm going to tell you, it's, even as a caretaker, it's one of the most helpless feelings that you have, because it's like there's nothing you can do. You feel like there's nothing you can do to make it go away or for you to go into remission. As a caretaker, there's nothing you can do to help. Like, you want to do everything you can to help, and there's nothing you can do to help. So that's kind of what a lot of these different things are. This information that we're providing you is for you to feel like you're actually doing something, which you are in most cases. But if you think about everything we've talked about doing, it gives you a sense of control. So you feel like you're doing something to help, whether it's enhance whatever path of treatment you decide to take, if that makes sense. So it also improves communication and connection. So sharing your artwork and experiences with a supportive group can foster a sense of community, reduce feelings of isolation, and encourage communication. Notice everything is about a way of communicating, and it helps to improve that. So you always want to communicate with your doctor, and you want to make sure you have a doctor that wants your communication and listens to what you have to say, because everybody's different. Everybody's body responds differently. You could have this same type of cancer as someone else and take the same treatment. You're gonna respond differently to that than someone else does. Like, for example, I know the chemo drugs have gotten better or not as much side effects, but they still have those really strong chemo drugs where it causes you to lose your hair. And I remember the story that my mom's oncologist was telling us, how this lady was, so excited she wasn't gonna have to shave. Because like when you lose your hair like you can lose your hair everywhere. So your head, your eyebrows, everywhere, your legs, and so your arms, everywhere. You can lose hair everywhere. And she ended up only losing hair, I think, up to like her knees or something. Like, it wasn't even her whole legs, and so she was a little disappointed about that. But my point being, everybody's going to respond differently, so you want to have that communication. And also, it will connect you with people who will understand what you're going through. You're going to feel like, because people who've never really understood, like, sometimes it's hard. I always say I never completely understood what my mom went through, but so another cancer patient, I can only understand what I can understand to a certain degree with what I know from being my mom's caretaker, but I can understand what their child is going through. Or like my dad always says, my dad might not can understand completely what I went through or what my mom went through, but he can understand what their significant other or their significant other is going through. So, but it's always nice having someone that understands. I know I talked about the story previously where when the guy that my mom worked with that had brain tumors, and because she had also had a brain tumor when in remission, like, she understood what he was going through, and other people around him didn't understand, like, the short-term, long-term memory loss aspects of it and other things. And so he felt such a relief talking to my mom because she completely understood what he was going through. So it's nice having that. You don't feel so alone. It also helps managing physical symptoms. So some art therapy techniques like body mapping can help you explore and articulate physical pain associated with cancer and treatment. That's always important, especially when you're talking to your doctor about letting them know where the pain is. Also, it helps boost self-awareness and self-esteem. So creating art can increase self-awareness, enhance self-esteem, and help you define and strengthen your identity beyond your diagnosis. This disease, I guess like any disease, can easily cause you to lose yourself. Lose who you are, forget who you are, because you're so focused on that and getting better and what do you need to do next. A lot of these things can help you not do that, not lose your identity. And some people lose it because their body's changing, they're changing. Kind of like women. A lot of women with, our hair is our identity, or our breast as a feminine sign. And so someone, when they lose their hair, they feel like they're losing their identity. Or if they have breast cancer and have to have surgery to have a breast removed, they feel like they've lost their identity. This is going to, this and other things, not necessarily just this, but other things that we talk about will help you work through that. So, all right, I'm cutting a little short today because we have appointment out of town for this little one. Say hi. Yeah. But yes, we will be back next week, normal time. And we're going to talk more about getting into art therapy and how to do that, your resources available for you for that. So thank you so much for watching. Thank you for your support. Please, I have a lot of fun things coming up and working on a lot of different things. So please like, share, and subscribe so you don't miss out. And if you find these helpful, hopefully they are helping you. And yes, enjoy your tea. And next week we'll see you under the willow tree. Thanks.